Tell me what you don't like about yourself.
Are you kidding? Everything. My body's dropping so fast, my gynecologist needs a hard hat.
Television shows like FX's Nip and Tuck and E! Network's Dr. 90210 have helped make plastic surgery more acceptable to the general public. Dr. Zachary Gerut joins us to talk about a new brand of patient coming through the door, the corporate CEO. Dr. Gerut, welcome. Are you seeing more high-level, high-powered executives who are baby boomers like myself come into your practice?
Well, there's no question that there's a movement in our society for people in the baby boom generation to start seeking out plastic surgery, perhaps as opposed to 20 years ago when it wouldn't have happened as often as frequently.
Are they coming in because they're looking to maximize whatever competitive edge they think looking younger, looking their best can give them?
I think so. I think corporate today wants 60 years of experience with a 40-year-old face on it.
And one of the things that you are known for in your practice is doing plastic surgery like facelifts in ways that minimize recovery time, but don't really fall into that category of quick fixes that don't last.
Well, that's true, and I've been very fortunate to have developed an operation that is a real and long-lasting facelift without the disadvantage of having to spend weeks hiding. People are usually back to their normal activity within just a few days.
And done with minimal anesthesia, I understand.
Patients can choose to be wide awake or they can choose to sleep through the procedure comfortably, but they have absolutely no pain, and that's one of the reasons they recover so quickly.
And let's look at a couple of the examples of patients who have actually been in your practice and look at before and afters. And here is patient number one. Tell me what she came in to do.
Well, this young lady came in for a facelift. She runs a sizable business, and she wanted to look refreshed, younger, like she had been on vacation. So we went through the normal situation. We did a facelift, and the next picture that you can see is her after just 3 days, back to work, back to her normal activity. 3
days later, she did this, and there's before and after again. So you can see the different kinds of things and the reshaping and the contouring. Let's go to a patient number two.
This is the same patient just a few days, 3 or 4 days after her surgery.
That's really quite amazing there. Look at the before and after in that case. And now let's go to to a gentleman who you had in, who you tell me came in for some work and was on the golf course the next day.
Yeah, the day after, he insisted on going out there just for a couple of holes. He swung the golf club a few times, but he felt so good and he had no anesthesia hangover because he was wide awake during surgery. And he put on his golf clothes and went out and played a couple of holes.
Are men coming in for eye lifts to take care of a little bit of this, or what?
Yeah, well, just like I have, a lot of guys come in to get rid of the thing that's hanging down. I see a disproportionate number of patients coming in for a facelift, both men and women, because this business of not having to recover is so attractive.
Give me a sense of how much procedures like this cost in your practice, a range.
Well, there's a very large range because we can operate on different parts of the face, but around the country, the range is even wider. The facelifts can range from $5,000 to $20,000, depending upon what's done and where you have it done, meaning which state.
Dr. Gerut, I'll be taking your card. Thank you very much, Dr. Zachary
Thank you very much.